I actually think that I think the biggest developments did come out of the HER2 space. There is nothing that is practice changing at this point in time, but I think a lot of these data hopefully will set the stage for phase 3 studies which are about to start or which are ongoing and which will be reported in the next several years. I think the study that clearly bears mentioning is the initial stage of the MAHOGANY study with Margetuximab. Margetuximab is an engineered trastuzumab-like molecule, and these data were presented by Dan Catenacci. So what was interesting is that he presented data for a chemotherapy-free option of Margetuximab with an anti-PD-1 antibody. And there was a high response rate. I think it was about 53%, with a progression-free survival of about 5 to 6 months. So I think it does suggest that chemotherapy-free options are ultimately worth investigating in this space as well. And actually, in a similar vein, there was a German randomized study. It was a randomized phase 2 study that looked at trastuzumab with Nivolumab and FOLFOX versus a chemotherapy-free combination of Ipilimumab, Nivolumab, and trastuzumab. So the Nivolumab, FOLFOX, trastuzumab arm certainly confirmed the activity of this kind of combination. Pembrolizumab plus trastuzumab and chemotherapy is now FDA approved in the US based on Keynote 811. And then, there was also more limited activity for the Ipilimumab, Nivolumab, trastuzumab combination. It again raises the question of, well, it does show that there is some activity for these chemotherapy-free combinations, but ultimately, I think the role of a chemotherapy-free combination in the first-line setting, I think remains to be defined.